Namaskar dosto, welcome to channel Toxicology on Board. Today in this video we'll be discussing another important topic that is the iron intoxication in the case of humans. So let's directly dive into the question. So we have question which of the following is the first symptom of iron intoxication in humans? Okay, this question is taken from ABT recertification examination May 12, 2000. Okay, so we have option A bloody diarrhea, option B we have convulsions, option C we have acidosis and fever, option D we have hepatic necrosis, option E we have gastrointestinal obstruction. The right answer is in the green text, that is option A, bloody diarrhea. So the first symptom in the case of iron intoxication in the case of human beings is you will find diarrhea, bloody diarrhea you can see in the case of humans. Okay, so here you can see that the first symptoms of acute iron intoxication typically appear within 30 minutes to 6 hours after ingestion. Okay, during the initial stage, this iron toxication, no, it is divided into 5 stages. Next slide I will show you. In the first stage, if you see, iron act as a corrosive agent. Okay, because of its physicochemical properties, it will act as a corrosive agent. It will directly irritate your lining of the GI tract. Whatever your GI tract will be, no, it will affect. So if you look into the common initial symptoms with respect to iron intoxication is GI distress. Why? Because whatever the lining of the stomach layer will be, no, that will be there. That's why you'll have severe nausea, frequent vomiting are the most prominent early signs. Coming to abdominal pain, you will have stomach pain, intense cramping or stomach pain, diarrhea. The question is bloody diarrhea. Our answer is often explosive and may be accompanied by black, tarry and bloody stools. Hematesis, vomiting blood. You will show vomiting will be there, or a bloody streak material will be there. And neurological symptoms: irritability, lethargy, usual tiredness, or extreme sleepiness, constipation, nausea, indigestion, stomach cramps, black tarry stools could be a sign of upper GI ulcer. Okay, so in the case of iron toxicity, you can see abdominal pain, vomiting as well as diarrhea. So these are, if you look into this one, iron has its own importance. It is used to treat anemia, boost hemoglobin, reduce fatigue, boost immunity, improve concentration and restore sleep. Okay, so in this video we'll in detail discuss about iron in which is mentioned under chapter 23 toxic effects of metals, page number 1134 and page number 1135. It is a part of DABT syllabus. It is given in your brochure, page number 28. It comes under domain 3 risk assessment. Okay, toxic agent metals. Okay, so let's see important symptoms. If you look into the early symptoms with respect to toxicity, if a very large dose has been consumed, iron in large excess quantity it has been consumed, additional life threatening symptoms can manifest almost immediately. So we have cardiovascular, respiratory, neurological collapse and metabolic acidosis. If you look into how it is affecting your heart as well your respiratory, is that it causes tachycardia, increase in the heart rate. It causes decrease in the blood pressure, that is hypotension, and fast and shallow breathing you will be seeing. Coming to neurological collapse, seizure, unconsciousness, entering a coma. And coming to metabolic acidosis, you will find a dangerous buildup of this acid in your blood, okay, often indicating a rapid breathing or confusion. This is how it is affecting your CNS. So these are the severe type of adverse effects which are caused because of excessive iron intake. Coming to important clinical observations, we have two points. Important thing, that is quiescent period and rule of thumb. What is this quiescent period? After the first 6 hours of exposure of this excess iron, no, symptoms may appear to resolve. That you can see in the case of stage 2. As I told you, no, the various stages of iron toxicity are being classified up to 1 to 5. So we are discussing about stage 2. Stage 2 is the latent one, where recovery from the GI symptoms occur after 6 hours or 24 hours of exposure. So that is the same point it is saying in the case of quiescent period, that is latent phase. After 6 hours of this exposure, symptoms may appear to resolve. The GI symptoms come recover. Okay. This is often an adaptive or it is called latent phase where the person seems to improve before potentially crashing into multi-organ failure. Coming to rule of thumb, that is the second point, absence of any GI symptoms. So you are not showing any symptoms within first 6 hours usually indicate that is a serious or lethal dose of iron was ingested in that particular patient. So till now we have discussed about the acute symptoms as well as acute and the chronic adverse effects. Okay, now we'll discuss, it is given in chapter 23, no, toxic effects of metals. So if you look into this one, metals, no, they are divided into four types, four under the major toxic metals, essential metals with potential for toxicity, metals related to medical therapy, minor toxic metals. So whenever you are reading about metal toxicity, keep this periodic table also in your mind, to which class of group, which particular class it falls. Okay, so now in this video we are discussing about iron. Iron is a essential metal which having, it is very important, it is essential metal we are taking, but excessive iron will cause some toxicity, so it has some potential for toxicity. As you can see, cardiovascular collapse, respiratory distress, neurological, these things, and vomiting as well as GI distress, bloody diarrhea, these are the things because of the excessive iron exposure. So in my previous video, we have discussed about fluorine. Okay, fluorine is minor toxic metal. Then that we have discussed about skeletal fluorosis and dental fluorosis. And in my channel, I have covered certain metals already. I have covered about nickel, I have covered about mercury. So go back and read. So always keep this particular flow diagram in mind. So you will be able to link, and always keep periodic table also mind, so that it will be easy for you to remember. So we are discussing now page number 356 under Clayson chapter 23 only, under toxic effects of metal. We are discussing in detail what are the important points which are given in the textbook with respect to iron. So if you look into this iron, no, iron is an essential metal. It is used for medical therapy. You have seen, no, but it has having some potential toxicity. So if you look into iron, no, it is an essential metal for erythropoiesis, for RBC formation. You need it. It's a key component of hemoglobin, HB, myoglobin in the muscle. Heme enzymes for the formation of hemoglobin, metalloflavoprotein enzymes, and mitochondrial enzyme. In the ATP cell membrane transport will be there, no, in that also it forms an important catalyst and as an ion. So if you look into the biological system, iron mainly exists in two forms. One is Fe+2, another is Fe+3. Okay, so also read, whenever you read other metals, no, whether you read chromium or vanadium, in which oxidative state is there, and which is oxidative state which is responsible for causing the toxicity. But iron here, it exists in two forms, Fe+2 as well as Fe+3. Okay, ferric and ferrous. Toxicological considerations are important in terms of iron deficiency. Since it is an essential, whenever the iron levels are less in your body, hair loss, certain things are there. So, iron deficiency due to idiopathic hemochromatosis or as a consequence of excess dietary or frequent blood transfusion. So, these are the reasons where you will come across iron deficiency. See, you can see hematocrosis, iron overload. This is a healthy liver, and here you can see in the case of hematocrosis, iron deposits you can see on the liver surface. And these are the various organs. You can see how iron is affecting pituitary, impaired growth and infertility, how it is having adverse effect of thyroid, hyperthyroidism. On heart, it is causing cardiomyopathy and cardiac dysfunction. In the liver, it is causing hepatic cirrhosis. Pancreas, diabetic mellitus. Gonads, it is causing hypogonadism. In the case of joints, this iron is causing joint damage as well as osteoporosis. So we'll lead what in the textbook is given with respect to acute iron poisoning from accidental injection. Always acute poisoning is because of suicidal or accidental ingestion or iron containing dietary supplements. If you take excess dietary supplements on that particular day, the most common cause of this acute toxicity. Severe toxicity occurs after ingestion more than 0.5 gram. So whenever you're taking anything above 0.5 gram of iron, that time you are getting this severe toxic effects with respect to iron. Or iron in the form of ferrous sulfate. So like this ferrous sulfate tablets will be recommended by your physician. So whenever you're taking more than 2.5 gram of ferrous sulfate in a day, at that time only you're getting this acute toxicity symptoms. Toxicity occurs after you take more than 0.5 gram or 2.5 gram of ferrous sulfate. After 1 or 6 hours, you will be finding it will start showing adverse effects. Symptoms include abdominal pain, diarrhea, and vomiting. As I told, remember our question was also same thing. Diarrhea, bloody diarrhea, black stools. These are the hallmarks of this excessive iron poisoning. Of particular concern are pallor or cyanosis, metabolic acidosis, and cardiac collapse. As you can see, iron is having adverse effect on heart. It is causing cardiomyopathy and cardiac dysfunction. Death may occur in severe poisoning, in particularly in the case of children. So more it is seen in the case of children after 24 hours of excessive iron exposure. It's more than 0.5 gram in a day. Okay. So what is the chronic toxicity? Till now we have learnt about acute toxicity of iron. Now we'll see chronic toxicity of iron, which is given in the textbook. Okay. So from iron overload in the case of adults is relative a common problem. So whenever they take excess iron tablets, no, there are three basic ways in which excessive amounts of iron can accumulate in the body. Why? What is the reason why iron accumulation is taking in your body? Number one is hereditary hemochromatosis due to abnormal absorption of iron from your intestinal tract. You have taken iron tablets, but if you have some heredity issues with respect to hemochromatosis, then what is happened? The amount of iron that need to be absorbed through your GI tract, it is decreased. So abnormal absorption of iron from the intestinal tract. As a result, what happens? Iron levels in your body keep increasing. Second one is excessive intake via diet or from oral iron preparation. You have taken a medication, you forgot, again you're taking. So in that case also excessive exposure will be there. Or you're taking something like spinach or certain foods are there which are rich in iron. So in that time, at that time also excessive iron exposure takes place. Third one is repeated blood transfusion. There might be certain dialysis patients or somebody who's having any conditions who are taking blood transfusion, and in that blood it is having iron content more. Repeated blood transfusion for some form of refractory anemia that leads to transfusional siderosis. Related to siderosis is the word which is related to iron. Remember this one. Then it is suspected that iron may act as a catalyst. As I told you, in the cell membrane, mitochondrial transportation, ATP generation will be there. No, in that it act as a iron act as a catalyst to produce free radical damage, resulting in atherosclerosis. That is in the case of blood vessels, and ischemic heart diseases. That also you have to remember. Some neurodegenerative disorders associated with aberrant iron metabolism in the brain include neuroferritinopathy. So, what are the adverse effects of iron on your brain? We are seeing now neuroferritinopathy, aceruloplasminemia, and third one is manganism. Okay, so these are the three new words that we are coming across. So let's very quickly run through what are these three words. That is neuroferritinopathy. It is a rare form inherited brain disorders. Here you can see asymptomatic, intermediate, and advanced, causing iron buildup. So iron buildup in the brain takes place primarily in movement centers, that is basal ganglia, due to mutations in this particular FTL1 gene, okay, leading to progressive movement issues like chorea, dystonia, tremor. So because of which we will have speech, swallowing problems, that is dysphagia, cognitive, you will not be able to remember things, okay. So this was about the neuroferritinopathy. You read in detail. Second one is aceruloplasminemia, ACP. It is also a rare inherited genetic disorder. Body can't produce enough ceruloplasmin. What is the ceruloplasmin? It is a protein which is needed to process the iron. Okay, causing iron buildup in the organs like brain, liver, and eyes. And here you can see aceruloplasmic. This will lead to diabetes, anemia, retinal degeneration, and progressive neurological issues like dementia and movement disorders. So you also read in detail about this one, aceruloplasminemia. Third one we are discussing about magnesium, which is related to metal manganese. Okay, go back and see in our chart manganese falls into which type. So it is a severe, again it is a neurological disorders. You can see here manganese caused by chronic excessive exposure to manganese. So because of this manganese metal, either the exposure is through inhalation, dust or fumes in the industrial setting, like those who are working in mining or welding. And important thing, exam point of view, we have to remember is it causes Parkinson like symptoms such as tremors, rigidity, gait issues, behavioral changes resulting from manganese buildup in your basal ganglia. In this area, manganese gets the buildup, deposited, increase in levels in the case of basal ganglia. Okay, so one question previously I come across. So, which of the following metal will have Parkinson like symptoms? Then you have to give answer manganese. Okay. So, read in detail, pause the video there and read about those three type of definitions. Then we are seeing short notes under Clayson CD summary which are given with respect to iron toxicity. This is a type of quick important point that we have to remember with respect of iron. Iron, it is bound to transferrin. Okay, this transferrin, it is produced in the liver. You have to remember this one. Two-third of iron is in the hemoglobin, 10% to myoglobin, that is muscle, and rest is stored bound to hemosiderin or ferritin. Okay, remember. Ascorbic acid, cysteine, and reduced glutathione release iron slowly. Okay, when iron with iron overload, this might be increased ferritin synthesis. Accidental ingestion, acute exposure, ulceration of the stomach, black stools, metabolic acidosis and liver damage, that is capillary endothelial damage, coagulation defects, late effects might lead to liver cirrhosis and renal failure. So this is again you have to remember. That is ulceration of the stomach and bloody stools. Okay. Desferoxamide, very important. Whenever excessive iron exposure is there, antidote desferoxamide act as a chelating agent. Next, iron oxide fumes, particles lodge in the lung and it will lead to lung cancer, tuberculosis and interstitial fibrosis. Okay, and important again, very important, which is given in the notes from the previous students I have seen about question was related to iron absorption. So iron absorption takes place in two steps. Okay, absorption of ferrous, we have seen Fe plus 2, Fe plus 3, Fe plus 2 ferrous ion from the intestinal lumen in the mucosal cell transferred to the plasma where it is bound to transferrin. Okay, transferrin which is produced in the liver. Okay, 3 to 5 grams iron in the body, about 67% is bound to the hemoglobin, myoglobin also, remember 10% bound to myoglobin. Toxicity usually due to injection of iron containing medicines. So iron tablets if you take in excess, that time it is there. And these are the repetitive points: bloody stool, ulceration of GI tract. Okay, and this also remember desferoxamine, the chelating agent, drug of choice. Important thing last before ending the video, I want you to go through is Clayson textbook only is given. This particular table 23.2 is given in the chapter 23, that is toxic effects of metals. In this they have listed out toxicity of several metals and metalloids. So what they have given is they have given a list of metals and they given the target organ toxicity. Here you can see CNS is there, GI tract, lung, kidney, liver, heart, blood and skin. Since the question, this video is respect to iron, so iron, it is causing adverse effects on the CNS. It's a target organ I'm saying. CNS we have seen, na? Neurological disorders it is causing. GI tract, ulceration it is causing. Lung, we have seen some type of tumors are also it is causing. And respiratory difficulty breathing. And liver cirrhosis we have seen. Blood anemic conditions we have seen. Okay, so pause the video here. Just don't read about iron. Also read about other metals also. In my videos I've already covered about mercury, I've covered about lithium also, I might have covered about arsenic also. So pause the video here, read each and every metal. For example, aluminium is there. What are the target organs? CNS, lungs, no other organs are there. Arsenic is there, it is affecting CNS, adverse effects on GI tract, lung, kidney, liver as well as blood, no adverse effects on heart as well as skin. Okay, so like that, you pause the video or go back to the textbook and read in detail so that it will be a very good summary for you to remember which metal is causing, which is the target organ in the body. Okay, so hope from this video you were able to learn in detail about the metal iron. So thank you so much. Be curious for any questions. Please write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel Toxicology on Board. All the best for your exam.